Measuring ankle dorsiflexion is very important. We use this motion in everyday activities like running and walking. We use it a lot when we bend over to pick something up off the ground, squatting, numerous other instances that are very important. And when we don't have enough dorsiflexion, it affects a lot of things up the chain, up in the knee, hip, low back. Um, so having good ankle dorsiflexion is very important. Unfortunately, many of us lose it because we almost never gain access to it. We never use it throughout the day. So we need it, but we don't use it nearly enough. Okay, so for this assessment, you will need to do a quick pre-measurement. So you're going to find a flat wall that's nice and plumb, and then you're going to take a piece of tape, measure 4.5 inches away from it, with the away from the wall, with the far end of the tape, the far edge, being the 4.5 inch mark. Okay, you're going to set up your camera really low to the ground with a good side view so you can see exactly what's going on at your foot on the ground as well as what's going on in your knee at the wall. The setup is very simple. I'm going to take a knee and I'm going to put my near foot big toe or longest toe right on the farthest edge of the tape. That's the 4.5 inch mark. Now we could measure your individual distance, but for the purposes of this assessment, we're just going to keep it simple and it's going to be pass or fail. So passing, the first thing that we're looking for is your knee to go straight over your foot towards the wall, and your knee should be able to touch the wall. And I can't pass right now, but your knee should be able to touch the wall without your heel coming up like that, okay? So if you can touch the wall with a nice flat foot going straight over the middle, then you pass. Now, one of the most common fault that I see is exactly what I just showed you. Someone's heel rocks up. If they touch the wall and their heel's up, it's not passing. The next one, and this is important for you to self-monitor, is that your knee stays over the middle of your foot and doesn't rock inside. So if I go inside, I can squeak out another little tiny bit. But if I go straight over the top of my foot, I'm still stuck kind of back here. Okay, so I fail that one. If you have any questions or if you're not sure if you pass this assessment, mark unsure on your scoring sheet. And then, of course, feel free to reach out with us, hold on to the video, and we'll be able to help you figure it out.